This is Mom Squad Pod, your weekly update on tips, tricks, and all things parenting with Maureen Kyle.
Hi, everyone. Thanks for joining us on Mom Squad, the podcast and now streaming show where we talk all things parenting. I'm Maureen Kyle, and today we are talking about something many new moms struggle with, breastfeeding. And now the American Academy of Pediatrics came out with a statement that encourages and supports moms to continue breastfeeding for 2 years and beyond. That can be really intimidating. So I'm bringing in two experts on this topic. So joining me in studio is Lauren Lasko, family nurse practitioner and lactation consultant with Neighborhood Family Practice. Lauren, thank you so much for being here.
Thank you so much for having me.
I'm going to talk to a pediatrician in just a moment because I want to get two takes on this, because when we heard about this, you know, all the moms that were in the newsroom when this came out, it was kind of like, oh, 2 years? Like it's hard enough to make it through
1 month.
That, yes, I mean, even the first few
Yeah,
weeks, but there are a lot of benefits. So we want to talk about the benefits. Like when you see something like this, what are the benefits for mom and baby?
Well, there are so many benefits. And like you said, I think it's important to acknowledge that this is a complicated recommendation. You know, parenting is complicated, right? It's never that simple. And I think the recommendation is great because it acknowledges the health benefits. But how we get there is the challenge, as you mentioned as well. So the benefits are numerous. I think we focus a lot on benefits for the child. So we know short-term and long-term health benefits for baby includes lower risk of diabetes, lower risk of childhood leukemia, lower risk for SIDS, lower risk for asthma. So there are so many benefits, but also for mom too. You know, we focus once again a lot on the benefits for baby, but for mom, there's lower risk for breast, ovarian cancer, high blood pressure, diabetes down the road. So there's definitely incentive to continue to breastfeed, but once again, we have to focus on how do we support families in doing this, because it certainly is a commitment.
Yeah, it is. I mean, it's like a part-time job. That's how I always felt.
It
so
really
we're going
is.
to go in depth with Lauren in a bit, but we have another Lauren. I asked Dr. Lauren Bean with University Hospital's Rainbow Babies for her take on this new statement from the AAP.
All right, so Dr. Bean, I just saw, recently that the recommendations for breastfeeding, how long to breastfeed, has changed. And so what is the American Academy of Pediatrics recommending at this point?
So the American Academy of Pediatrics released the new recommendations, and specifically the goal of the new recommendations is really to support breastfeeding efforts if desired by mothers who wish to breastfeed for a longer period of time. So specifically the guidelines say that for women who would like to breastfeed for really any amount of time, including up to 2 years or more, that's great. And the AAP supports that. And then we as a medical community and society should also support that. So that's really the biggest change is really the language surrounding those, the recommendations. The recommendation is still to exclusively breastfeed if possible for the first 6 months. That hasn't changed, but the support for continued breastfeeding is just being better verbalized.
So this isn't something that, if somebody's struggling, I just think of the friends that I've had that have struggled to breastfeed during even that first 6 months. A year seemed really intimidating, even for people who didn't have trouble breastfeeding. A year feels intimidating. And then when I saw this, I'm thinking the pressure is on now to feel like you have to continue longer. But is there any pressure? I do want to talk about the benefits too in a little bit.
Yeah. So there's no intended pressure. I know there's perceived pressure. And I'll admit, when I first heard these guidelines, I thought, what, really? But then I sat down and I read them and realized, oh no, they're not saying you should breastfeed until 2. It's just that if women desire to, that's great. And I think that this is sort of in response to a sentiment that is often conveyed by women who are breastfeeding beyond a year, who sometimes feel ridiculed for breastfeeding longer than a year. And maybe even feel shamed to do so in public places. And so that this is more to say, this is great, we support you. It is not Nowhere in it does it say women should breastfeed until age 2. And so, I think my message is to please don't, you try not to feel pressured by this. I am a mother. I breastfed both of my babies, and I didn't make it to a year for one of them. And I struggled. Everyone struggles. Breastfeeding is so hard. It's really it's just and people have issues for a lot of reasons that are very valid. And so the AAP doesn't intend to make anybody feel like they're inadequate. They want to support those who want to breastfeed for longer. So that's really a misunderstanding that I think is circulating around social media.
Yeah, I'm glad we're clearing that up, because even the articles that I read kind of makes it sound like, it focused on the benefits. And I think when moms read the benefits, who doesn't want prolonged health for their baby? And I was reading that, it's lower risk of upper respiratory infections, and it sounded like better gut health for the baby. Is that accurate to say that all of the nutrients that are in breast milk does help with all of those?
Well, so there's evidence to support that. And I think, sort of speaking from myself as a pediatrician, not as like, I'm not really a representative of the AAP, but speaking as myself, my goal as a pediatrician is to support families, is to support families' feeding plans. And this document that was published by the AAP, I feel supports society, and society's need to do a better job of supporting breastfeeding women, and to help with that sort of make this not for women who do want to breastfeed for longer, to make it not an unattainable goal. And I think for a lot of women start out breastfeeding and they want to breastfeed exclusively. They want to breastfeed for 12 months. And, because our society doesn't support those women well, they are often met with challenges that make it impossible. And so this guideline, I think, really is to set a framework for how we should expect society to support women. And I don't think that we as women and mothers and people who are or have or plan to breastfeed should take it as a recommendation that we should do this. That's not the goal of the guidelines. So I think that, breastfeeding is wonderful, but maternal mental health is also essential. And so when I have patients and their mothers are struggling to breastfeed, my priority is to make sure that everybody in the family is okay. And if breastfeeding isn't working, then we use formula, and that's just fine too, as long as it's available and there isn't a shortage. But and I think I don't mean to speak for the AAP, but the guidelines do include a line that, they understand that breastfeeding doesn't always work out for women. And so this is specifically for women who desire to breastfeed for longer durations.
What about, because you bring up the formula shortage and then just formula in general. I'm thinking of maybe moms out there who have an almost 1-year-old that was thinking, okay, I can start on cow's milk or any other milks. Do you think that somebody could interpret this, and whether they want to or not, as, should they be sticking on formula longer than a year if they want those nutrients for their child?
That's a good question. And I don't think so. I don't think we can extrapolate that. I think that, after a year, babies and toddlers don't really need the additional nutrients that are in formula. And they can really get everything that they need through a well-balanced diet. And then, what infants get from milk, whether it comes from breast milk or other types of milk like cow's milk, soy milk, pea milk, it's a convenient source of calcium, vitamin D, protein, and fat in a ratio that is, good for what babies need nutritionally to grow and have good brain development. So that's, we don't really need the extra nutrients that are in formula. I think that, again, I don't mean to speak for the AAP because I'm not them, but there's a lot that goes into breastfeeding beyond the nutritional component. I think it's seen as a bonding relationship that the AAP, I think, wants to support that as well. So I think it's more than just well, what are the nutrients in breast milk? It's also about that relationship that can be very helpful for families when it's working well. It can also be very, very stressful when it's not. And so I don't think that the AAP means to disrespect that it is stressful. But they just want to make sure that those women who do want to breastfeed are feeling supported.
Right. I'm sure you have a lot of parents who come to you, moms specifically, that are really struggling in that first 6 months or so. What do you recommend to them when they do come to you and they say, I'm struggling with breast milk, with supply, with keeping up, because it is like a part-time job. And then they have those concerns that they can't, that they feel like they can't provide for their baby. Sorry, here's one of mine.
I know, I love it. This is where working moms.
I know. And this is my third, and I really did feel like it was a part-time job to help while I was at work and breastfeed. And she clearly inherited the camera hog gene that I have. But
I know, I love it.
What do you recommend to specifically?
Yeah. And so again, this is, for me as a general pediatrician in my practice, my goal is to support the goals of families. And so every family has their own goals with regarding to feeding their baby. And I genuinely just want to make sure that I am supporting families in what those goals are. And if those goals include breastfeeding, great. If breastfeeding is not an option, that's fine. As long as we can find the formula is a wonderful source of nutrition for babies too. So I spend a lot of time trying to help families not feel like they're in some way inadequate or they're failing because they're having trouble breastfeeding, because there are so many things that can make breastfeeding a challenge, stressful, or even impossible. Many things that are completely out of our control. And so, I want women to feel supported and fathers to feel supported. I want infants to have adequate nutrition and growth. And, and if that happens to involve exclusive breastfeeding, awesome. But if it doesn't, then that's totally fine. So for me, I just try to get everybody on the same page and communicate our feelings, help us know, okay, what are our goals? What are our struggles? And, let's just focus on making sure everybody is okay.
Yeah. Dr. Bean, this was great, because I know you kept saying you don't speak for the AAP, but I mean, every parent out there will read this, go to their pediatrician and say, can you interpret this for me? What does this mean? So this is really insightful. I'm so grateful.
She was so great. And Dr. Bean also admitted to me afterwards, and I don't think she'd mind me sharing this. She is a mom. She mentioned that, and she talked about how with her first, she breastfed for 18 months and felt like there was a stigma of her going too long. And then she struggled with her second to get through those first 6 months, which I feel like so many moms have that experience. There's a stigma, there's a pressure. It's like, how long is too long? How short is too short? How long should I actually go? What about that stigma? I mean, how do we start to break that?
I mean, that's a question. I think we have a lot of work to do there. I think culturally we have a lot of work to do, and I think it's complicated. I think we have a lot of pressure from all sides. Like you said, you kind of feel like you almost can't win. If you go too long, then you have the stigma there. If it's too short, then you haven't done enough. And I think that's what's really challenging for moms. I know in a support group that I run, when we were talking about the new guideline and we said, yeah, everybody has to breastfeed till 2 years, that's recommendation. There was like this big sigh of like, oh man, that's okay, all right, we're going to have to try to do this now, you know. And I think that I think things like this help. I think opening up the discussion that a lot of families, want to breastfeed this long. I have a lot of patients who kind of quietly ask me, like, can I can I keep nursing if I want to?
Yeah.
Which absolutely you can. I think at the end of the day, it's about choice. And I think we all have to work together to honor that every family is going to make the best decision possible.
Yeah.
But I will say that's with the right amount of education and support about the benefits of breastfeeding. So we really know why we're making this decision. And, you know, it might be that extra motivator to keep us going, but also we need support from our medical professionals. We need support from our employers. It's so complicated. So I think we all collectively have to, you know, work towards really ultimately just empowering families to do what's best for them.
You and I talked off camera about, you mentioned about workplaces and the federal support that's in place and what this recommendation or suggestion by the AAP will do for women who are working and pumping. So what do you think this will do for them?
Yeah, I think that it will open up the conversation to allow women, hopefully, to be able to pump longer if they want to. Right now, the Fair Labor Standards Act protects us federally to pump for 1 year, that employers should, they're required to provide that support for us. So now with this discussion open, I don't think that's shifted yet as of last night when I was doing my research. But I think that will open up the discussion to hopefully allow employers and really push employers to protect their employees who do want to pump longer. Because certainly if you do want to make it to 2 years, you have to be getting milk out of the breast. I mean, you have to be pumping and telling your body that you want to continue making milk. And so it is very challenging once you stop pumping to keep that going for that long. So that's certainly a barrier. So I do hope that this policy statement will help employers and also the federal policy and the federal legislation to change.
I remember trying all sorts of tricks, and I didn't really struggle with supply issues. I'm sorry if this is too much information for listeners and viewers, but I just remember this was a discussion among friends too of how to keep up that supply. And there's all these myths and there's all these, like, if you eat, you know, lactation cookies and if you drink beer and if you take this vitamin. But if somebody really does want to go for 2 years, how do you keep up that supply? Like, what are some of the health things that women can be doing to make sure that they can continue that long?
Yeah. I think on the mom's end, just on what you can do is truly, it's just good old supply and demand. You know, we can buy all the doodads, we can buy all the lactation cookies, but at the end of the day, if we're not moving milk out of the breast, our body simply just like receives those signals and kind of shuts things down a little bit. And so, you know, it's also really, really important that we start early sending those signals to our body to make milk. We have a very, very critical phase in the early days postpartum and the early weeks postpartum, where if we're really able to remove milk out of the breast, whether it's through pumping or through breastfeeding, that we're able to really lay down a framework for the long-term goals. And so that's what I tell my patients a lot is like, this is the time to really send those signals to your body by getting milk moving. So that when you want to be breastfeeding 6 months from now, when you want to be breastfeeding a year from now, and now maybe 2 years, that we've done the work in the beginning. But it's tiring, and that's where that support comes in. Not only from your own family, you know, your own little, you know, support group in your community, but from us medical providers. We have to be able to be trained to support you and to tell you those things. Lots of families don't even know that removing milk from your breast at night is critical to milk supply. So in those early weeks when your baby's waking you up in the middle of the night and you're like, oh my gosh, not another feeding. Those are actually critical times for your supply to not only increase, but be sustained for a longer period of time. So it's that knowledge, I think, that will really help. And also, once again, hopefully if your employer is going to make those changes to support you for the long term, but you have to be, once again, supply and demand. The more you're able to get milk out of the breast, the more you'll make.
And those first few weeks are a struggle. I'm sorry, they're just a struggle. And that's where a lot of women, even if they want to breastfeed, if they feel like their supply isn't up or maybe they're struggling, that's where they decide, you know what, I can't do it. If somebody's in that situation and they would come to you and say, can I break through this barrier? Can I make it happen? Can they? Or do you run into some people where supply is just an issue?
Yeah. There are some women who just don't make what we call like 100% of the milk that their child is looking for. But breastfeeding is very dynamic. It is, it can be all shades of the rainbow in terms of what breastfeeding looks like in your family. Some families choose to do both. You know, there's absolutely ways. I always tell families, this is not black and white. If you want to breastfeed, you can breastfeed. Is it going to look exactly like what you thought it might? Maybe not. You know, maybe we need to use a little bit of formula as a tool. And sometimes we don't even need to use formula if they're not wanting to, but there are herbs, there's different medications that sometimes can increase supply. It truly is individualized because everybody's different and everybody has a different capacity to make milk. But once again, those early days of support are so critical in the long term. You know, if you can really get that good support, not only from your loved ones, but also from the people you trust medically, you're going to be in such better shape to reach those goals down the line. I also think too, really knowing ahead of time and having a plan about that, you know, I'm going back to work, you know, maybe meeting with a lactation consultant maybe a month or two beforehand and say, here's what I want to do. And they'll really tell you, you know, how often you need to be removing milk, how to store it, how much milk your baby's probably going to be needing. One little thing that happens a lot, and maybe you've experienced this, I know I did, was that oftentimes our caregivers give our babies a little bit more milk of our breast milk than they technically need. So moms all of a sudden start feeling like their milk supplies are going down, when really it's just that they're getting like some really big meals while they're away. And so that can stress moms out, you know, and so it's important to kind of understand really what babies are supposed to take versus what people think they should be drinking. So that can feel kind of stressful and challenging. So once again, it's just education, I think, and support.
And through Neighborhood Family Practice, you do a support group, or tell me about the support group, just in case anybody's out there and thinking, do I need a support group or do I not need a support group? What do I need?
I mean, I will say, not only professionally, but personally, I think support groups are great. We do have a support group once a month. So Neighborhood Family Practice is a community health center here in Cleveland, and we do provide lactation support services, not only for our patients, but for anybody in the community, because that's the whole point, is like, we know people need support. You can come, you don't have to be one of our patients, and we can help you. We also teach a free breastfeeding class every other month, and research shows us that if you get that prenatal education, plus postpartum support, that's really where the magic happens when it comes to making milk. So that's why we try to design something that you have that support early on, so you can start thinking about things ahead of time and then know you have that support immediately. You don't really have to think about it. You're just like, okay, I'm going to a lactation consultant, I'm gonna be fine. And research shows us that when you get that support about 3 to 5 days after delivery, the chances that you'll breastfeed longer and more exclusively are much, much higher.
Awesome. And Lauren is a really fun follow on Instagram at Mala_lactation.
Thank you, yes.
So lots of good information there.
My poor children.
Oh, they'll love it one day. All right, Lauren Lasko, thank you so much for joining us.
Thanks for having me.
This was fun, and it was really informative, so I really appreciate it, especially with those new recommendations.
I know.
And thanks to all of you for tuning in to Mom Squad. We'll see you right back here next time.
Thanks for listening to Mom Squad Pod with Maureen Kyle from WKYC Studios. Subscribe now so you never miss an update. And find more on everything you heard here on WKYC.com and on the WKYC app.